My name's David Shenker. I'm a physician here at the Women's Clinic. At the Women's Clinic, we take care of a lot of women's issues. And one of them that a lot of my patients I find are a little bit hesitant to talk about is urinary incontinence. Urinary incontinence is the involuntary loss of urine. The statistics are actually that about 22 million women in America are walking around with incontinence and not talking to their physicians about it. So it's a common problem, and we try to bring it up here at the clinic so we can offer some solutions. The most common type in younger women is stress urinary incontinence. Stress urinary incontinence is caused by an increase in intra-abdominal pressure, which actually causes the bladder to squeeze and leak urine. So when I talk about that, we're talking about women that lose urine with coughing or sneezing or exercising, things like that. Anything that will increase this intra-abdominal pressure will make the bladder leak. That is usually a structural problem. There are some things you can do on your own for stress urinary incontinence. Weight loss is one. Weight loss will help immensely sometimes with especially stress urinary incontinence. There's that increase in intra-abdominal pressure just from weight. So we also encourage weight loss as a non-invasive way to help correct some incontinence. Everybody's heard of KEGEL exercises. Your physician can help you isolate those muscles and exercise them just like you would any other muscle. There's even physical therapy. We actually offer referrals to a physical therapist for actually helping train those muscles and helping identify them. So it's important to try these non-invasive methods first. Another type of incontinence is urge incontinence. Basically, that's an involuntary loss of urine because you have a spasm of the bladder and you have this sudden urge to go, and a lot of people can't make it to the bathroom in time. Urge incontinence is not a structural problem. It is overactivity of the bladder, the muscles in the bladder. So we have to calm those down. And methods that work for that are, simple ones are something called a voiding diary, where you actually keep track of how many times a day you're urinating and how often you have to run to the bathroom. We record that, we see the intervals between those, and then we try to work on training, extending that length in between. And that works for a lot of people. If they mentally try to take their mind off of it during that period, we can extend those times out and get their bladder trained back to where it will not spasm so much. If that doesn't work, we go on to medical management of it. There are medicines called anticholinergics that block part of your nervous system that make that bladder spasm. What most women have actually is something called mixed incontinence, which is a little bit of both. We encourage you, if you're having this problem, to please let your doctor know, because there are solutions that can really change your quality of life. We really would like patients to try to avoid surgery and medicines by lifestyle changes. But the reality is that some people's incontinence is just too much to do on their own. So when we talk about surgery for incontinence, there are several types. They're called a sling procedure. And so a sling is literally a piece of mesh that we put underneath the urethra to recreate that floor and that support. I think it depends. You need to tailor that to the patient, the type of incontinence they're having, and what the physician's comfortable doing. But they're all the same basic principle of recreating that floor for the urethra to sit on and not lose its structure. So the surgery is fairly simple and straightforward. It can take anywhere from 10 to 30 minutes to do. Most of them are pretty painless afterwards. You go home the same day. You have very little pain, very little bleeding, and the results are so good from it. They're almost immediate after the procedure, and people are very happy with it, and there are very few complications from it. Again, at the Women's Clinic here, one of the most important things for us is quality of life, and we want to make sure that everything from hormone replacement to urinary incontinence, that you're not dealing with issues later in life that you don't have to be dealing with. So make sure you bring this up to your physician, because there might be something quite simple we can do about it.